All right, it's 11:02. We'll get started with our exposure management webinar. So thank you all for joining. I'm really excited to present our exposure management feature that's a part of health and safety. And we're actually going to walk through how to implement our feature today. So with me, I have a couple of our product team and um, engineering members. So we have Chad and Jordan here today to help with questions. And then I'm Claire. So I'm one of our product managers. I'm the lead outbound product manager for health and safety. And we're going to walk through how to implement exposure management. So if you have any questions, feel free to put them in the Q&A portion and we will answer those as we go through our presentation today. So just some housekeeping rules for our session. This session will be recorded and posted on the health and safety community page. So if you haven't gone to our community page yet, that essentially is where we'll post events like this. We'll also post blogs and other articles about health and safety. So if you wanted to rewatch or share to someone on your team, that's where the session is going to be posted. Throughout our presentation today, feel free to put any questions in the Q&A portion or the chat. We'll answer as we go, and there's also going to be a dedicated time to ask questions at the end of our presentation as well. And then if you want more information about our health and safety products, whether it be specifically about exposures or any of our other products, check out our docs page as well as our community page. Again, that's where we'll post all of our content. So be sure to check out those resources. So from an agenda perspective today, we're first going to go through an overview of exposure management. For those of you that are not on the call that are not as familiar with what exposures are, we're actually going to walk through some of the business context, and then we'll actually get into the product. So we'll walk through a live demo of exposure management, and then we'll start going a little bit more technical. So we'll actually go through our architecture and our data model. And then finally, at the end, in terms of implementation and considering how do you implement exposure management, we'll walk through some technical considerations. If you are new to health and safety as a product, we are a dedicated product for employee health and safety. And within our product, we have six applications. So if you go out to the ServiceNow store and you see and you type in health and safety, you'll actually be able to see our six applications here. And I love this slide because it really showcases what is in each of our applications in terms of features. So today what we're covering is our exposure management feature. We released this in our January 30th release of health and safety. Health and safety as a product is a little bit different from some other ServiceNow products. We are a store-based product. And so unlike the family products, we release 4 times a year. So we did just release our exposure management feature, which is why we're walking through how to do some implementation to give you some tips and tricks on that. So you're probably asking, unless you have a very in-depth background of environmental health and safety or being an industrial hygienist, what is an exposure? So essentially, an exposure is anything that has potential to cause harm, illness, discomfort to the immediate or long-term health of an employee. And the severity of this is going to depend on the duration and the level of exposure. So oftentimes, organizations will monitor things or exposures to determine the impact on an employee's health. And we see some examples here. So they could be things like noise, temperature, radiation, chemical or air quality. And your customers might have additional exposures that are unique to their organization or unique to the industry or type of work that employees are in. So we actually deliver 5 exposure types out of the box, and we'll get more into what those exposure types are and how that works in our solution. But for this, what you need to know is an exposure essentially is anything that could impact the health of an employee. So if we think of an example like noise, over time, if it is at a certain level and a certain duration, so if you're working every single day in a factory that has a certain decibel of noise, it might actually cause hearing loss over time. Whereas if I'm sitting in my office in Boston, I hear one loud honking of a horn outside, that might not impact my health. So essentially, what organizations are going to do is monitor the exposure levels to make sure that it's not negatively impacting their employees' health. And there's going to be two things that they'll look at. So, first, they're going to look externally at regulations to determine exposure limits. So, certain organizations or regulatory bodies will actually have recommended or required limits of exposure. And if it goes above that certain threshold, then an organization is liable for the employee and needs to take action to make sure that they're preventing um, negative health impacts. And also, organizations or your customers are going to look at their internal policies. So they'll actually make policies to determine if, say, the external regulation is a set number, they might actually be a little bit more severe with their number. Um, to make sure that the health impact, there's less risk of that health impact from or exposure from impacting their health. So exposures could really be anything. It could be that chemical, it could be a radiation or noise. At the core of it is going to impact that employee's health. So once you know what an exposure is, you then will start to walk through your exposure management. So exposure management essentially is a part of the risk management program. And the goal of this is to anticipate, recognize, evaluate, and control and protect employees from workplace hazards. First, you need to determine, are there exposures present for the employee? Can it negatively impact our employee here? So then you'll go into this phase of recognizing, where are the exposures, what are the sources, how are they impacting the employee? Then you'll evaluate, what is the duration, what's the level, what would be the impact on an employee's health if this exposure were to continue or to be there over time. And then what they're going to do is, after they've evaluated it, they know there's an exposure impacting an employee, they'll then put in measures to control and protect employees. So these could be through controls, they could be through, certain trainings or assigning out actions to employees. But the goal is to make sure that they're protecting employees so that the risk of this exposure impacting employee isn't getting worse. It's being managed. With exposure management, it's a systematic method to collect information to determine that course of action. Again, it's always going to be based on the amount and duration of that exposure. So essentially the level of exposure. And they're always going to be double checking this and going back systematically to collect that information for that course of action. If it's a higher level of exposure, they might be more severe in their actions or take more action than if it's a lower exposure level. And they're always going to implement control measures to prevent additional harm. Again, the goal is to make sure that employees are not being harmed while they're at work. So control measures will be put in place to mitigate that risk. And then also, because of regulations and for internal policy, all of this needs to be documented with the findings and also the impacted employees. So if I'm an employee, I go back to my company after a couple years and ask them for a record of all the exposures that I have been exposed to while working at the organization. An organization has liability to provide that information. So a lot of record keeping for these exposures, because it is impactful on an employee's short-term and long-term health. Now, walking through our exposure management workflow here, I went a little bit at a high level when I walked through the exposure management explanation, but this essentially is going to guide us through that workflow. We have it in stages here, and if we look from our left to right, it will go down. First, we'll start to conduct those risk assessments, essentially to identify potential hazards and those exposures. For example, a company could have ordered a new piece of equipment. Maybe there's a machine that employees are working with. Oftentimes, the EHS team or the environmental health and safety team is going to first evaluate the risk and the impact on employees' safety and health. And from there, they'll identify that there's an exposure hazard. Once they know that there's this potential for an exposure, they'll actually create a plan for how they're going to manage that exposure. So within ServiceNow, these are actually going to be the names of features. So we'll have our exposure types and we'll be able to create those specific exposure types. Now that we know that we have this exposure and that it needs to be managed in the workplace, we'll start to categorize the data that's being collected about that exposure. So what is the exposure limit? What determines to make it an exposure? Again, based on that duration and level of exposure, that's actually going to determine, is it an exposure or is it something that needs to maybe be monitored until it is an exposure? And then also defining the employee criteria. So who is actually being impacted by this exposure? Not everyone in the organization is going to work with that exposure. They might, but there is going to be set criteria of the location of who is actually working with that exposure. And if we go in our if we follow our arrows here, we'll then go and assess the exposure. So then what they'll do is, now that they know that there's the potential of an exposure, they'll start to collect measurements. So the duration of the exposure, the amount of the exposure, and they will track those measurements and compare them to the exposure limits. Again, not every potential exposure is going to be an exposure. So they'll assess it to those measurements to say, okay, there's actually now been an exposure and it's impacted these employees. And they'll assess that on the impact on the employee health. Once there has been an identified exposure, they'll then go through and control the risks and continuously monitor that exposure. So has the exposure level gone up? Has it gone down? Do we need to do different actions to make sure we're mitigating the risk? And we have our arrows going in a circle here because this portion of the workflow is going to be continuous. They're always going to continue to define those exposure limits based on internal policies, based on set regulations. If employee criteria has changed, if employees' jobs have changed, or the location of the equipment has changed, for example. So they'll always be reassessing what is categorizing that exposure. They'll always continue to collect the measurements and assess the impact on employees' health. And again, they're always going to be controlling and monitoring those risks and assigning out actions. That's why this is going to go in a circle to make sure that they're evaluating and monitoring this exposure. From a user persona perspective, we have two key personas here from more so the business side. The first one's going to be the EHS team. These are generalized personas. Every organization, depending on the severity of risk of the organization, as well as the size of the organization, they might have more granular roles that are specifically working through each of these tasks. But here we have our EHS team, and the goal of their job really is to identify workplace hazards through risk management programs. So they'll be conducting risk assessments, inspections, and audits, not specifically about exposures, but they're going to be looking at the workplace, the jobs that employees are performing, the roles that they're in, to assess what hazards are present. So hazards can be anything that harms an employee, and to make sure that they're implementing control management and corrective or preventative actions. They're always trying to mitigate that risk of the employee's health or safety from being impacted. We also have our industrial hygienists. And so their role is actually to really focus on occupational exposure levels. Again, these are going to be based on both internal policy and external regulations. So they're going to look at the threshold set by internal regulations, and they're going to determine if they want the same threshold or be more conservative with their measures. And the goal of their job really is to focus on those workplace exposures and determine the course of those actions and controls. So very similar to the EHS team. However, industrial hygienists are really going to focus specifically on the exposure rather than hazard control in general. Now that brings us to what our specific feature that we've built in health and safety. We have our exposure management feature. It's part of our risk management application. And what we've built is the ability to manage those employee health risks. So we've built out the exposure management process. So starting from identifying the exposures, assigning them, monitoring them, and creating even similar exposure groups. We've also built how to automate those exposures. So being able to set the exposure threshold, so that limit for what determines that it is an exposure, and also assign actions to employees in a bulk fashion to reduce that hazard or exposure risk. And then it's also part of our complete health and safety tool. So we actually have our risk assessment capabilities. We have our case management capabilities for occupational health surveillance. So this is part of a unified health and safety product. It's not separate modules that don't work together. This works seamlessly within the product so that if exposures are identified, maybe there's a occupational health case, it's all going to be within the same workspace for your safety and EHS teams to work through. So we'll now get into a demo here. I'll take a pause and see if there's any questions in the chat. I don't see any questions yet, but I suspect we'll get more questions as we go through our demo here. So we're going to look at our instance here, and we're logged into our health and safety workspace. Again, we released this feature in January of this year. So it is January 30th, 2025, if someone's watching back on the recording. And we released it within our risk management application. So if we look at our workspace here, we're logged in as an admin so we can see everything, but we actually have dedicated roles for exposure management, and we'll go through those roles later. And as we go to our risk management icon here, we can scroll down to see our exposure types. So customers during implementation would determine what exposures are relevant to their organization. Again, it's going to depend on their industry. It's going to depend on what their employees are actually working with. So we do provide categories out of the box. We provide these 5 categories here, but they can be configured to the customer's preferences. So the exposure type essentially is a grouping of that exposure. So for example, we have noise here, and this can be associated to a campus. Now this location information is pulling from the WSD location hierarchy. And so that's going to enable your customers to be more granular with reporting where this exposure is. Exposure severity is going to depend on the amount of exposure. And if you're further away from the exposure source, you might have less of amount of exposure. And so location is really, really key to determining exposure levels. So that's why we provide flexibility to have more granularity in where this exposure is or where the source of the exposure is. So say the piece of equipment, and your customers can be more granular with that. So we'll just choose, let's go Maryland Campus 1. We can have buildings, we can do floors, we can do rooms and spaces and areas, really identifying where exactly this exposure is. Next, we'll choose our category here, and we'll do our name, exposure, and we'll choose the state of the exposure. So we'll have it be active, but if we're looking at this later and we need to deactivate the exposure, maybe it's no longer relevant, maybe the piece of equipment that was causing this exposure or the chemical that they're working with is no longer being worked with at the organization, you can have this be inactive. And then we'll choose our category. So you'll see here that there are subcategories as well, depending on how the exposure is being essentially presented to the employee. So for chemical, it could be through inhalation, it could be through ingestion, it could be through dermal. So if it gets on their skin, it's a different type of exposure and there's a different exposure level than if it's inhaled. And we provide those subcategories. So we'll do noise here. And you'll see that there are no subcategories for noise. Next, we're able to associate any risk assessment. So say the EHS team has done the risk assessment and identified that there is the potential of exposure. They can actually associate completed risk assessments here and have that referenced on our exposure type. Similarly, if we have our chemical or maybe radiation here, we can actually reference our safety register, and this is going to pull in the chemical information to this exposure type. So we'll save this off. And once we save this, we are able to do our next step in the process, which is creating an exposure assessment. So what we've done is create the type of exposures. Now, your customers aren't going to be creating new types often unless they do have the flexibility, but essentially you'll set up your types and then you can start performing your exposure assessment. So if your customer is already implemented, they're happy with their types, they're not going to be doing this step every single time. They'll only do it to create their initial types or add more as needed. So now we'll go to our exposure assessments here, and we can actually start creating the exposure assessment. So we can choose multiple locations here because maybe there are multiple locations in the area that have the same type of exposure. So say we're doing noise exposure and we wanted to do it for 5 rooms at once. You can select as many rooms as you want, or you can just select one at a time. This is going to create all of those exposure records at once. However, you still need to conduct the exposure assessment one by one per record. Now, as we open up our exposure assessment here, we'll see that it has defaulted to that exposure category of noise because that is where our exposure type came from. And we are able to see the location that we chose as we were building this exposure assessment. We can add any additional information like description here if we wanted to further document any information about the exposure assessment. And the most important part to our exposure assessment here is our exposure creation conditions. So this is where we're going to set the conditions for what determines an exposure. Essentially, what is the measurement or the level of exposure that will classify this as an exposure that needs to be monitored by the organization. Now, this is our creation builder, and this is using the condition builder from the platform, and it is flexible. So we can see here that we're pulling from different fields within exposure management, things like measurement or measurement units. We also have time-weighted average. And so what you would do is determine what attributes about the exposure, the measurements, that you want to set to be that threshold that creates the exposure. So what we'll do here is measurement is, say, 85. That is what OSHA has as a noise measurement. And let's see, it is greater than 85. So now we know if there is an exposure and it is greater than 85, or a measurement that has now been tracked that is greater than 85, it's going to create that exposure. So we'll set this. And now we know what determines it to be a exposure. Those measurements can be changed. So say external regulations or the internal policies change and they say, actually, it needs to be 80 decibels of noise in order to determine that it's an exposure and that monitoring of that exposure is needed. Your customers or you will be able to easily go in and edit those conditions within here. Next, we need to determine who are the impacted employees of this exposure. Again, not every employee, or maybe not every employee, is going to have that same level of exposure. And so this is where using the condition builder, you can determine the affected people. So these can be based on attributes such as location. It could be based on attributes, we'll dot walk here. It could be attributes such as manager, perhaps a certain management team is working with employees that work in a with a certain role. It could either be job, role, it could be title. All of these things are attributes from the health and safety profile here. So we'll be able to choose that. And for the simplicity of this, we're just going to say any user that's active, but you would be able to be more granular with that. So it doesn't need to be every single employee that's active in the table. It just needs to be the attributes that you're assigning to that. So now what we'll see are we have 52 matching results. So these essentially what this is saying is we now, based on the affected people conditions, we have 52 potential people that could be impacted by the exposure. Now, at this point in our workflow, we don't know what the exposure measurement is, but we do know that these 52 people could be impacted by the exposure. Thus, in the future, they might have, adverse health impact. So what we'll do next is we'll save our record here, and this is building out our assessment. So essentially, what are the conditions for the exposure? And then we can start adding our measurements here. So we'll choose the date and time of our measurement. Let's say it's right now. We'll choose our measurement unit. If you remember, we are doing a noise exposure. And so what we've done is set this measurement unit to default to dBA, which is noise decibels for noise. And each of our exposure types are going to have their own measurement units. We'll actually walk through a little bit later of what those measurement units will be for each of the corresponding types, but it is important to call it here that there is going to be a default measurement unit depending on that type. And then we'll put in our measurement unit, which is 110 decibels. OSHA actually says, I think on one of their charts, that that's the sound level of a club. So this is quite loud. And then you can also put in your time weighted average. So essentially that's the average of time. So it could be 8 hours of noise that this employee is hearing this level of noise. And we'll save that. And we also can identify an exposure source. So the source is essentially where this exposure is coming from. It could be an asset, it could be a safety register, it could be a machine. An asset is going to pull from ALM assets. Maybe they're not using at the asset tables. So we also have a machine. We'll just say that it is, we'll just say it's a we'll just say a machine. And you'll be able to choose that source again, depending on what type of exposure it is. If you're evaluating a chemical exposure, then you'll use your safety register here. We'll save this. And this is really for more reporting visibility of where this exposure is coming from and where these measurements are being taken. So now we have our measurement in here, and we'll be able to and we refreshed our screen. And what it's going to do is automatically create those exposures. So with the process, we didn't want it to be a manual process and add more steps. There's going to be many exposures, many employees that are being impacted by the exposures, many locations within the organization, and it would be quite manual to come in every single time and manually look at what this measurement is and then create that exposure. So what this is doing essentially is from these set conditions, now that we've input the measurement, it will automatically generate this exposure record. So it's saying that there has been an exposure identified based on those attributes or the exposure limits that you've set. And it's going to create this unique exposure record, and it will assign out every impacted employee their own exposure record. So now we know that David Liu, because he's working at that certain location or with that certain exposure, has been exposed. The important part of this is if you were to do an audit or David Liu were to come back in a couple of years, you would be able to see when this exposure was, what the exposure level was, and have full visibility into David's exposures that he's worked with. So again, all of this is created automatically. We can go into our exposure details though. We can add, maybe it's a high level exposure, 110 decibels is high. So we're identifying it or classifying it as high. We also can have end dates. Again, if the exposure maybe there's been a change in the organization, maybe they're not working with the chemical anymore, maybe the source is no longer there, you can actually end date it. So you can still track this information. You still can look back and see that David had this exposure, but it's no longer an active exposure. And then you can also change the state of it. And then you can add control measures. So again, part of the industrial hygienist's job is to continuously add control measures. So controls can be anything from administrative controls, engineering controls. There is a hierarchy of controls, which we'll talk about a little bit later. But essentially what they'll do is they'll go through the process to say, can we eliminate this exposure? Can we substitute something else in for it because it is harming employees or could harm employees? And they'll go to the bottom of the list, which essentially will be PPE. So we can put PPE in here and we can say, you need earmuffs and earplugs while you're working with this exposure because it is a loud noise exposure or a high level of exposure to noise. And so as you're working with this, you need to wear the certain PPE. So after we've now identified our exposure here, we'll then go back to our exposure assessment record and we can schedule exposure actions. What we're looking at is our action scheduler. This is right now unique to our exposure feature, and we can say hearing test. So these are essentially going to be actions that are scheduled actions that need to go out. So say, for example, every single year you require your employees to do a hearing test. So from there, you can actually start benchmarking and identifying what the impact on an employee's hearing has been. But you can have your short description here. You can say this is critical that you need to get it done. It is preventative to have your hearing test. We can choose our location as Maryland campus. And the days to complete after action creation is how many days that this employee has. So today is the 20th. We'll give them 10 days. That will take us to March. And you'll see that it will actually set a due date for them. And because it's a schedule, we can also have it be recurring. So say every single year, you have the duration, so maybe monthly, weekly, to have a new action go out to that employee. So when we save this, it will generate 52 actions for those 52 impacted employees. So instead of going down the list and saying, okay, Joe, Evan, and Jack were impacted employees and manually creating those actions, it will automatically generate those actions. They'll have their own record here. And if you look at the table name here, this is the SN OHSIM action. This is the same action that's part of all of the actions within health and safety. So if you are using risk management today or you're using incident management within health and safety, this is the same action table and it's creating those actions. So you'll be able to continue to report on those actions. You'll be able to set due dates, see when they're overdue, have notifications and reminders. So quite a bit of functionality within this action. One last thing that I want to call out here is you can add documents. So if you do have documents. Documents actually live within our configuration tables here. So we have our configuration area and you have standards and documentation. I just have one example of documents in here, but if we open up this document, you'll be able to see that we have different document types, hyperlinks. They could be knowledge articles. If you're storing your internal policies within knowledge within ServiceNow, you can actually associate those to the exposure type. And then we have some subtypes. These are all configurable. You can upload PDFs to them and then also associate expiration dates. So lots of functionality within documents, but what you'll be able to do is associate those to your exposure record. So as you're going through your exposure assessment, if there's any documentation that you need to review or have from a record keeping standpoint, you can add it here. Now that's everything I have for our demo of exposure management, but we'll go back into our slides here and we'll continue to go back into our demo instance as we walk through some things, because this gave an overview of exposure management, but now as we get a little bit more granular into the information, sometimes it's easier to see it again as we walk through. So from a application standpoint, exposure management is a part of our risk management plugin. So it is our health and safety risk management plugin on the store. The latest version is 5.0. So if you went into store today, you would need to download version 5 in order to see exposure management in your instance. And we are always N-2 compatible. So we have Yokohama, Xanadu, and Washington here, and there are no dependencies. We provide roles out of the box. Our customers have the flexibility to create additional roles or reconfigure their ACLs. But out of the box, we have 3 roles here. We have our industrial hygienists who can create those exposure types, conduct those assessments, and assign actions to people. We have an exposure writer who can create and update exposure-related records. And then we have just our exposure reader who can view exposure records. So this link will actually link out to our docs page in order to see what those roles are. So if you're looking at the PDF after, or the PowerPoint after, that will link you out. We went through a lot of different terms today, all beginning with exposure. And so I created this dictionary just to reorient everyone for which part of the exposure management workflow we are in. So we have our exposure type. There will be the prefix of EXT, and that's just a type of exposure. So for example, it could be noise, it could be chemical. Exposure assessment is where the record type where the industrial hygienist will go in to identify the exposure, set the limits, create multiple exposure records using the condition builder. The exposure is the prefix is EXP, and that's when there has been an exposure identified. Again, there's the exposure assessment is saying there's the potential for the exposure. The exposure record is saying there is now an exposure. And then every individual employee is going to get their own affected people exposure record, and that's EXPU. And this is going to be related to that specific employee record to say that there has been an identified exposure. If another measurement came in, hypothetically, and there was another exposure identified, they would get a new record. So these are all going to be unique records. This is our data model. I'm not going to go through the entire model here, but I think it's always beneficial to see how we built exposure management from a data model perspective. So you can always take a screenshot of this or review back to it. And these are essentially the tables that are part of exposure management and the table names. The white boxes essentially are platform tables, so like location or asset. These are unique tables that are part of health and safety as a product, but are used across other areas. So for example, documents or profiles. And then we have our, I guess this is teal here, is part of exposure management within our risk management plugin. So earlier I alluded as we were walking through, and I'll pull up my instance here, as we were walking through the measurements, we open up our measurement, that there's going to be this measurement unit that's set by default. So with our exposure types and measurement, this slide essentially highlights what the exposure type is and what the corresponding measurement. Oops, go back one. And so for temperature, we have Celsius and Fahrenheit, depending on where your customer is in the world or how they track temperature. Air quality, we have ppm. Radiation, we have rem. And chemical, we have ppm too. Note, these measurement units can be configured as well. So if they have additional ones, maybe they wanted to add a different measurement unit for noise or for air quality, they absolutely can within that field. And something else to note here, if you create a new exposure type, then you'll need to do the corresponding measurement unit as well. Otherwise, it will just be blank. So now we'll get into some foundational data, and these essentially are key parts of data that need to be collected to ensure your implementation success. So foundational data is all data that needs to be configured to support the features of health and safety. They're common tables shared across other applications with the instance, and these data elements should be reviewed prior to beginning a health and safety implementation. So to start, you should review your employee or user data. So have employees within your sys user table. But something else to call out here is health and safety references our health and safety profile table. So this is our table name here, and we will always reference that table. So first you need to put your employees within the sys user table and then create those health and safety profiles. The other thing, the other key part of foundational data that you'll need to do is have locations. We saw today how locations are very important to exposures, but throughout health and safety and other places of the platform, location data is important. So it is necessary to have that location information within your instance. We have some more information on locations here. They are a crucial part of health and safety. We are using WSD locations, so we'll see this hierarchy here, again, allowing your customers to be more, or yourselves to be more granular with where this exposure is occurring. And we have a note here that they're defined via the class field on the C&M location record. You can always remove that class reference qualifier from the location if they wanted to select other locations instead, but we do recommend having it to improve performance when searching for those locations. Next, we have our health and safety profiles here. What this is essentially is a dedicated profile to access all safety related information about a user. It will display related safety records related to the user. So actually, if we go back into our instance here, you'll be able to see your health and safety profiles within configuration. Again, we're logged in as admins, so depending on your role, you may or may not be able to see this information. But within here, you can see David here. We are able to see any information about David. This is a unique table, so it is our health and safety user table. It has information like his department, his employment start date, his date of birth, maybe his locations, and then any other related data about him within health and safety. So we actually can see his exposures. Within our health and safety profile, the users can be employees, contractors, or visitors, and these are the tables that they're referencing. And again, they need to be added first to the health and safety profile, since any health and safety table will reference the users that are in this table. And I have a little note here. You can configure additional attributes on this profile if you want to collect other information about that specific employee. You can add them to our profile here. As a reminder, health and safety is a scoped application. So although it is in the ServiceNow instance, it is scoped. So only those that should be seeing this information will be seeing the information. I know that's really important for specific health information, specific GDPR regulations. So it is a scoped application. So only the people that are seeing health and safety info and that health info should be seeing it. Next, in terms of data that needs to be set up before a health and safety implementation are our hazards and controls. So these are used throughout our health and safety risk management feature. Hazards are essentially any potential source of harm to an employee. So it could be a circumstance, an event, or a substance. A hazard could be poor air quality, for example. Controls are things that are put in place in order to mitigate the impact on an employee's health or safety. So say, for example, the hazard is poor air quality. The control might be wearing a face covering at work. More information on the hazards and controls and using risk assessments can be found on our health and safety boot camp on Now Learning. Our team hosted a boot camp for implementing actually the risk management module amongst some other features as well. And I would check that out if you're curious to know more about hazards and controls. Now, when we were walking through our exposure management assessment or our exposure assessment here, and I'll pull this up so you can see exactly, if we're following along in your instance, we have our exposure creation conditions and our affected people conditions. Some considerations here: exposures are going to impact employees that work with the exposure. If you are not working with it, then you're not going to be in that impacted group. So you will need to do an exercise to determine the similarities in exposure groups. The more similarities you can find, the easier it is to build within that condition builder. The condition builder, you can add multiple conditions onto it, so you wouldn't have to do just employees in one location, and that's just the only attribute. You can add more than one, for example. And information about this can be identified via risk assessments or conversations with managers. Managers are often going to be more familiar with the day-to-day of an employee's job responsibilities. So what they're working with, the equipment that they're working with, the roles. So having conversations with them to collect that the similarities is important, unless you already have it logged. But if you're starting fresh, for example, with exposure management, you might need to actually do that exercise to figure out what similarities in those attributes are. And just a recommendation from our team: start high level, go more granular. First, determine the exposure types, what employees are working with loud noise, and then start to think about what roles or jobs they're exposed to. Are you more likely to be exposed in one job than another? Locations that are likely to be exposed, and roles and jobs that work in that location. So you'll be able to start identifying similarities in those groups, and that is going to be your exposure affected people. For the exposure creation criteria, some considerations to think about. So that criteria, again, is the set threshold that's going to determine if an exposure is generated, and these are essentially the occupational exposure limits. They're going to align to standards for what determines an exposure and when the industrial hygienist will need to take action. And you will determine, or your customers will determine, what the set threshold is, but they can be updated as needed. So those will be determined on internal policies or regulatory policies based on industry and geography. So if you're in the United States, OSHA has some lists. If you're in Australia, Safe Work also has lists. Some additional sources here. I have some additional sources that you can check out. They do have limits that they post on their websites, but also toxicologists, occupational health teams, and doctors also will have recommendations. These will always vary on location, industry, and internal policy as well. Some common configurations here. Your customers are going to configure their exposure types. They also will configure their locations, maybe their measurements if they want to add additional fields to their measurements, or any additional attributes on the health and safety profile to filter criteria. And then some other common design consideration and decisions. So first, creating that exposure list, identifying exposure or risk assessments, or maybe your customer, you have your existing list. You can import that into ServiceNow. Determining the occupational exposure limits to set those thresholds. Consider exposure types by location if accounting for regulations. Different locations will have different regulatory bodies and regulated exposure limits. So as you're going in to build your exposure type, there is the ability to do a location on that. So if you're doing your exposure type, maybe US noise is different than Australia noise. And then determine similarities in exposures to help build that criteria builder. What roles are employees working with? What jobs are they working with? Roles are different than jobs. So role could be electrician, whereas their job is, you know, working with copper wire for the day, for example. What are there specific job tasks that are more prone to exposure? Where are employees working? How close are they to an exposure source while they perform their job? Employees that are working right next to the exposure source while they perform their job are going to be more likely than the employee not working there. For example, when you go to the dentist, they do x-rays, and the hygienist usually will step out of the room to do that x-ray, and they'll put the lead jacket on you. For example, the hygienist is going to have a higher level of exposure potentially to radiation than maybe someone working at the front of the office. So again, you're always thinking about how close are they to that exposure, how often are they working with that exposure, and that's all going to determine the exposure severity. And then we just have a summary here of features and benefits with your customers. And using this feature, they'll be able to create those exposure types, easily adjust the limits. They'll be able to change those as needed, and really enhance automation around the exposure management process. So automatically identifying infected employees based on those set criteria, bulk assign those corrective and preventative actions, and it's part of our risk management application. So you'll have complete visibility across the risk and occupational risk of your workplace. And then also being able to track exposures at an employee level for that historical record.